Welcome to the deep dive. Today we're tackling a really common issue, back and neck problems, specifically the kind caused by herniated discs.
That's right.
And if you're maybe exploring ways to find some relief, but you're not quite ready to think about surgery yet, well, you're in the right place.
Mm-hmm.
We're going to explore something called nonsurgical spinal decompression, or NSDT, as a potential solution.
Yeah, and herniated discs, they can really be debilitating, whether it's in the lower back, the lumbar region, or up in your neck, the cervical area.
Oh, yeah.
Basically, the cushiony disc between your bones bulges out, maybe even tears a bit.
Yeah.
And it can press on nerves. That's where the pain and other symptoms often come from.
And for you listening, our goal here today is really just to give you a solid, hopefully easy to grasp overview of what NSDT involves.
Right.
We want to look at what it might offer, without getting lost in all the super technical jargon. Consider this your kind of fast track to the key information.
And to help us do that, we've got a couple of key research pieces. First, there's a 2022 study. It was published in the International Journal of Clinical Practice.
Okay.
And that one looked specifically at NSDT for lower back lumbar herniated discs.
And the second one.
The second is an interesting case report, also from 2022, from Clinical Case Report Medicine.
Oh, okay.
And this one details a patient who actually had several herniated discs in their neck. Multisegmental cervical disc herniations is the term. And it looks at how NSDT was used in their case.
Gotcha. So our mission really is to pull out the main insights from these two sources.
Mm-hmm.
We'll explain what NSDT is, what this research seems to suggest about, how well it works, and maybe help you figure out if it's a path worth exploring further.
Sounds good. Okay, So let's get into it. What exactly is this non-surgical spinal decompression?
Well, fundamentally, it's a type of traction therapy. But the key difference is it uses a motorized device. And if we focus first on the lower back, those lumbar discs, the study we mentioned gives a pretty good idea of the process. You lie on your back on a special kind of table or bed that can actually split in the middle.
Okay.
Then they use harnesses to gently, secure your upper body and your lower body.
And it's clever because it's not just a simple pull. There's a computer program running the show.
Ah.
It carefully controls the traction force, the direction it's pulling, even the angle. And it's all tailored based on which specific disc is the problem and your own body mass.
So it's quite personalized.
Exactly. The study used a device called the Spine MTK1. Think of it like a smart bed. It doesn't just pull, it can adjust the angle slightly to really hone in on that target disc. It even had built-in air bladders for support.
And they don't just yank on you, right? The force is applied gradually.
Oh, absolutely. Very gradually. In that study, they started the force at half the person's body weight, minus about 5 kilograms, so roughly 11 pounds, less than half their weight. Okay. And then they only increased it by 1 kilogram, just over 2 pounds each session. So it's a very gentle buildup.
And it's not constant pulling either, is it?
No, it works in cycles. The study protocol used a 60-second hold where the traction is applied, followed by a 30-second rest period.
Okay. Pull and release.
Exactly. And crucially, you, the patient, always have control. There's a safety button. If you feel anything uncomfortable, you can hit it and immediately stop the tension.
That's reassuring. And what about the schedule? How often did people go?
For that lumbar study, it was 10 sessions total, spread over 8 weeks. They did it twice a week for the first 2 weeks, and then just once a week for the last 6.
Okay, that makes sense. Now, what about the neck, the cervical discs? That case report mentioned a slightly different setup.
Yes, a bit different for the neck. In that case, the patient lay on her back on what was called an SDS treatment bed. Her head and neck were carefully positioned and secured using a cervical vertebral retractor. And again, the parameters, the settings, were specific to her herniated segments, which were C3-4, C4-5, C5-6, and C6-7, so multiple levels.
And the settings themselves were different, too.
Yeah, the report mentions her neck was slightly flexed forward, about 25 degrees. The traction cycle was 60 seconds of pulling at 17 pounds. Then it released down to 10 pounds for a 30-second relaxation phase.
17 pounds, okay.
And they repeated that cycle 20 times per session. Each session lasted about 30 minutes, and she did it 5 times a week.
Yeah.
So definitely more frequent than the lumbar protocol.
Right. Much more frequent. Okay, so that's the how, but you mentioned it's different from regular traction. What makes NSDT stand out?
Yeah, this is where it gets really interesting, I think. Traditional traction has been around, but NSDT aims for more precision and theoretically more effectiveness.
How so?
Well, one major claim is that NSDT can significantly lower the pressure inside the disc itself. Some studies suggest it can create negative pressure, like less than another 100 mmHg.
Wow, negative pressure, like a vacuum. What's the thinking there?
Exactly, kind of like creating a vacuum. The idea, or the theory, is that this negative pressure might help retract the bulging part of the disc.
Ah, pull it back in.
Potentially, yes. And it might also help drawing fluids and nutrients, which could, promote healing. Though the extent of that healing effect is still debated. But reducing the pressure likely has other benefits too.
It's like taking pressure off the nerves.
Precisely. Less pressure on irritated nerves, and also potentially less pressure on the small joints at the back of the spine, the facet joints. It does this by gently widening the space where the nerves exit, the intervertebral foramen.
Okay, that makes sense. Less pressure, potentially less pain. You also mentioned something about muscle relaxation being different.
Yes, that's a key point. Unlike some traditional traction where your muscles might tense up and fight the pull, NSDT systems often have feedback mechanisms.
Feedback, how does that work?
They monitor the muscle tension, the spinal muscles along your spine. If they start to tense up too much, the machine can actually ease off slightly to allow them to relax.
Huh.
Interesting. This relaxation is thought to allow for a stronger, yet still comfortable decompression force to be applied compared to traditional methods. It overcomes that muscle guarding reflex.
So it's a smarter, more targeted approach to getting that stretch or decompression?
You could say that. And by relaxing those muscles, it's also thought to reduce stress on the posterior parts of the lumbar spine. Some proponents even suggest the computer control aims to create a sort of zero-gravity environment just within that targeted disc.
Zero gravity in the disc, wow. Okay, so that's the theory and the mechanics. Let's get to the evidence. What did that 2022 lumbar study actually find? Did it work?
Right, the evidence. So this was a randomized controlled trial, which is, the strong study design.
Yeah, gold standard.
Yeah, pretty much. They had 60 people with subacute lumbar herniated discs, meaning pain lasting between 4 weeks and 3 months. Half got NSDT, half got a sham or pseudo-decompression. They went through the motions, but no real force.
Okay, and what did they measure?
They looked at a few things. Lower back and leg pain using that VAS scale 0 to 10 pain rating.
Right.
They measured functional disability using the Korean Oswestry Disability Index, or KODI. That's a questionnaire about how back pain affects daily activities like walking, sitting, lifting.
Okay, function is key.
Definitely. And maybe most interestingly, they did MRIs 3 months after the treatment finished to look for actual changes in the size of the herniation. They used something called the herniation index, or HEI.
MRI changes. Okay, so what were the results? Did NSDT make a difference?
Well, in several ways, yes. They found that the leg pain intensity was significantly lower in the actual NSDT group at the 2-month mark compared to the sham group.
Okay, less leg pain. What about function?
Function improved too. The NSDT group had significantly lower KODI scores, meaning less disability at both 2 months and 3 months after treatment.
That's encouraging, getting back to daily life. But what about the MRI? Did the discs actually change?
This is where it gets quite compelling. The MRI showed a significant reduction in that herniation index, the size of the bulge in the NSDT group.
How significant?
On average, the HI decreased by about 27.6% in the NSDT group. In the sham group, it only decreased by about 7.1%.
Wow, nearly 4 times the reduction. That really suggests something physical is happening.
It does. And maybe even more telling, over a quarter, 26.9% of the patients in the NSDT group had a reduction of more than 50% in their herniation index.
Over half the bulge gone for some people.
Exactly. And none of the patients in the sham group saw that level of reduction. So it seems NSDT didn't just affect symptoms. For many, it led to measurable physical changes in the disc.
So the study concluded that NSDT could be a decent conservative option for these subacute lumbar cases.
That was their conclusion, yes. A suitable conservative treatment option. But it's important to note, while both groups did see decreases in back and leg pain over the 3 months,
Oh, okay.
the difference in overall pain reduction between the groups wasn't always statistically significant at every single time point.
So maybe some of the pain relief happens naturally anyway.
That's what the researchers suggested. Subacute herniations sometimes improve on their own over that kind of time frame. So NSDT seemed to clearly help with reducing the physical herniation size and improving function, but the pain relief aspect might be a combination of the treatment and natural recovery.
Right, the body does heal. Okay, interesting nuance there. Let's switch gears to the neck then. That case report on the woman with multiple cervical herniations, what did that show?
Right, this was just one person, a 44-year-old woman. She had significant neck pain, numbness down her left arm, and her MRI showed herniations at multiple levels, C3 down to C7. Plus, her neck curve was actually reversed.
Ouch, sounds pretty severe. And she received NSDT with that SDS system plus something else.
Yes, combined with electroacupuncture, or EA, acupuncture with a mild electrical current.
Okay, combination therapy, how did she do?
She had this combo for a month, and the outcomes reported were, frankly, quite dramatic. Her neck pain went from an 8 out of 10 down to 0.
0, wow.
Yeah, her neck movement returned to normal ranges.
That's fantastic. What about the numbness and strength?
Her left hand grip strength, which was weak, only 7.5 kilograms more than doubled, up to 19.2 kilograms.
Huge improvement.
And the follow-up MRIs were also impressive. They showed significant improvement in the herniated discs themselves, less compression on the spinal cord and the dural sac around it.
And the neck curve.
That improved significantly, too. The index they used went from negative 16.04% to negative 3.50%, indicating a much more normal physiological curve was restored.
Amazing. And did these results last?
According to the report, yes. At her 6-month and 1-year follow-ups, she reported no dizziness or neck discomfort.
That's great long-term news for her.
The researchers suggested the SDS traction likely worked through several mechanisms, directly reducing the hernia volume, that negative pressure effect, opening up the nerve spaces, but also indirectly by relaxing the neck muscles and stretching the joint capsules.
Now, you mentioned she had some initial discomfort.
Yes, and that's an important point. During her very first session, she felt some neck pain and a burning sensation in her head for about 15 minutes. They paused the treatment. She rested, felt better, and then continued without any further issues for the rest of the month. It really highlights that careful application and monitoring are crucial.
Absolutely. So the conclusion from this specific case was that the combination of SDS traction and electroacupuncture was effective and helped restore biomechanics in her neck.
That's what the report suggests. Yes. Very positive outcome in her case.
Okay. So we have these 2 studies showing promising results, one for the lumbar spine, one for the cervical. But as always, we need to consider the nuances and limitations, right?
Definitely. It's crucial to have a realistic perspective.
So what are some of the key things we should keep in mind?
Well, first, that lumbar study focused specifically on subacute herniations pain from 4 weeks to 3 months.
Right, not chronic long-term pain.
Exactly. And the patients were between 18 and 60 with no prior spinal surgery and no severe neurological problems. So we have to be careful about applying these findings directly to, say, someone with very chronic pain or someone older or someone who's already had surgery.
Good point. The results apply best to the group they studied. Anything else from the lumbar study?
Well, interestingly, more people dropped out of the sham treatment group, and some of them reported their symptoms got worse.
Huh. Maybe doing nothing wasn't helpful either.
Could be. It also reinforces what we said earlier. While NSDT seems superior for shrinking the disc and improving function, the pain relief might be partly natural recovery. So maybe a multifaceted approach, combining NSDT with other things, could be best.
Makes sense. And for the cervical case report, what are the caveats there?
The biggest one is that she received both NSDT and electroacupuncture.
Right, the combination.
So we can't isolate the effect of the NSDT alone. The electroacupuncture might have contributed significantly to her excellent results. We just don't know how much was due to which therapy.
And it's just one person's story.
Exactly. It's a case report, not a large trial. Her results might not be typical for everyone with similar issues.
And both sources really seem to stress that this needs to be done correctly with proper monitoring.
Absolutely essential. Proper application, careful monitoring key for both safety and effectiveness.
Okay, so let's try and wrap this up. What are the main takeaways from this deep dive into NSDT research?
Right, summarizing. Non-surgical spinal decompression, NSDT, it does show definite promise as a non-surgical approach for certain types of herniated discs, both in the lower back and the neck.
Okay.
The lumbar research suggests it can physically reduce the size of the herniation and improve daily function. Pain relief happened, but maybe partly due to natural healing too in that subacute phase.
In the cervical case, while just one person and combined with EA showed really remarkable improvements in pain, function, strength, and even spinal alignment on MRI.
Exactly. Very positive, but with those caveats. So it's crucial to remember this deep dive gives you a snapshot based on these specific sources.
Yeah, it's not the final word.
Not at all. But hopefully it's good information to empower you as you explore different options for back or neck issues.
So thinking about all this, what are your initial reactions? Or maybe what further questions does this raise for you about non-surgical spinal decompression? If this is something that resonates with your own situation or even just your curiosity, what might your next step be to learn more. Definitely some food for thought there when considering ways to manage spine health.